Thank you for joining this training today. Today we will be talking about screening and the benefits of screening and what we can do right now to really come together and help our community by addressing some of the mental health concerns we see right now, as well as the concern with substance use. So today we're going to talk about a three-step process. One is an actual pre-screen and to see if you need to go forward on to screening. The second part is showing you an example of a reliable, well actually two valid and reliable screening instruments for people that would show positive on a pre-screen, need to go on the screening. And then we'll talk about the third part is if a person does, once they move from the pre-screen onto the screening, indicate that there might be a need for assessment and diagnosis, give you the parameters that you can now feel comfortable that now this person that's come in front of me, I know that they were struggling. I wasn't quite sure what. We're able to screen them for alcohol, substances. We can get you trained in using screening for trauma, anxiety. We'll give an example of depression screening today with the PHQ-9. And you can confidently do that within your place in the community or within your private practice. And then those that you can handle, you can give them brief intervention because we train on that as well. Or you will be more equipped to know based on these results, it would be most advantageous for this person if we move them on to a more acute, which is a higher level of care where they need actual assessment and diagnosis. So we're going to go ahead and get into the training. So a couple of objectives we're going to look at today is that we're going to identify the key components of the alcohol, smoking, and substance involvement screening test, which is called the ASSIST, as well as their applications in a primary healthcare setting. Again, like you'll see as we go through, it can be done within a primary healthcare setting as well as other community settings. We're going to outline methods and goals for implementing these screening instruments in your daily practice, and we're going to look at it in a way that you use as little patient or client and staff time or participant in staff time as possible. One area I did mention, we've actually trained and implemented this within criminal justice settings as well, shelters, like I said, local churches, nonprofits, local government entities. So this is a very flexible approach that you can use. And if you take it to the more extent into the full evidence-based training, it's called screening, brief intervention, and referral to treatment. That can be implemented and actually is reimbursable within some settings. So we're going to also describe the appropriate follow-up procedures for those patients who screen either positive for alcohol or other drug use, misuse, or maybe they score on the depression scale where they might need more of a intense intervention. So one thing that screening does not do is it does not provide a diagnosis. It is important to recognize that the difference between an assessment or an evaluation, or like a psychiatric evaluation, which is intended to make a diagnosis, and a screen, which is intended to identify the potential for problems. And so because the screening tools in the screening process is meant to identify the potential for problems, it can be done by someone who is not licensed, but they do have to be trained and capable of implementing the actual screening process with fidelity, meaning that doing it in the way that it was intended to do. We'll talk about how the screening instruments that we'll be using are reliable and valid, and they've been tested through independent research. And then this will make a little bit more sense as we go through this process. So because you know that approximately 75% of the adult population will rule out, it is advantageous to provide a simple universal screen. So the number of 75% is taken that from current research, we know that about 5% of the adult population in the United States would meet criteria for a moderate to severe substance use disorder. We also know from current research that 20% of the population would show that they have issues of either misuse, hazardous use, or what we used to call abuse when we had the two categories of substance abuse and substance dependence, but now it's substance use disorder, mild, moderate, or severe. So it can be a person who has a potential for problems, maybe has some harmful use, or they meet criteria for a mild alcohol or substance use disorder. So historically, what we've been doing is spending a lot of money on addressing 5% of the population, but we haven't been having a good intervention to work with that other 20%, that if we effectively intervene, we could divert them off the path where they would not get to that 5% and have a moderate to severe substance use disorder. So universal screenings are provided to all patients. It serves to rule out patients that are low to no risk, and it can and should be done at intake or in a crisis situation. Positive universal screen equals proceed with full screen. So when we talk about universal screen and full screen, the universal screen, as we'll talk about, is that pre-screen where you're asking just maybe a range of 4 to 7 questions that can screen for about 2 to 3 different things that we're looking for. So, for example, it could screen for alcohol, substance use. We've done them to where they do also with anxiety and depression. Then you might add, say, another couple of questions where it keeps it within about an 8-question max, where you might add trauma for some trauma-informed care. Key thing to understand is that that initial pre-screen can be done in 3 to 5 minutes. Also, which is more the common route, people do what's called a targeted screen. That's provided to specific patients or participants or clients. They've shown some type of indicator that maybe they had a positive blood alcohol test. They might have a urine drug screen that showed positive if they went to the doctor. They might have the smell of alcohol in their breath, or maybe you see them where they're nodding out and you're kind of concerned that they might be either misusing a prescription or possibly using some illicit drugs. So persons who score positive on the universal screen would also be considered a targeted screen. So, but universal, the goal is to take away the stigma that comes with substance use and mental health disorders, is that if you only screen targeted, people can feel judged and feel like you are making a judgment without any actual facts, and it could push them off and damage the therapeutic relationship. Whereas if you screen everyone every time, it takes away that stigma. It just becomes a normal part at the actual office or the process with an intended frequency that you might do that. And also it's great because someone might be doing great that's coming to your organization, and they're doing great for a period of 3 to 6 months, and then they go through a tough period. Having that regular universal screening would then have that show up. You would see the concern, be able to identify why it's early. The interventions would not be nearly as time consuming or severe, and that person can be back onto a healthy lifestyle from that. All right, in 3 to 5 minutes, a valid and reliable screening tool can provide enough information to achieve the 7 goals listed below. Screening provides a number of things that are important in understanding the individual patient and their relationship with substances, their level of risk, the likelihood of benefiting from a brief intervention, and if they are likely to need further assessment. And like I said, this particular part is focusing on substances, but also what you get in the 3 to 5 minute screen is to know if somebody might be dealing with some symptoms of anxiety, some symptoms of depression, and then you can then move that person along to get the appropriate help that they may need. This is the quantity frequency pre-screen developed by the National Institute of Alcohol Abuse and Alcoholism. When multiplying the amount of alcohol consumed on one day, multiplied by how many days per week to come up with the total amount that a person has consumed within 1 week. And now we're going to look at key things to look at. We want to know how often and how much. Then that's going to help us to determine that total for the week. If the total is more than 14 drinks per week for men under 65, they are at risk and the assist needs to be completed. So this pre-screen question would have indicated that, they are now drinking at a level that could be harmful to their health and maybe complicating a situation. If this is being done in a doctor's office, it could be impacting the way that their blood pressure medication works. It could have some exacerbation or making their diabetes worse. If the total was more than 7 drinks for women and men over 65, they are at risk, and the assist is to be completed. The difference between the 14 drinks for men and the 7 drinks for women is all about biology. Women metabolize alcohol differently, and so it takes less alcohol in their system to get their blood alcohol content where it would be more of an impact on their system. And once a male gets to age 64 and over, or you can say 65 and over, it will be the same scale that you're using. So the next thing we want to look at is what they're doing on a particular day. So male ages 18 to 64, if they've had more than 4 drinks at any one sitting or more than 5 drinks in a day, you still would want to move them forward. So an example where that may happen, they may only drink 2 times a week, and they're drinking 5 drinks each time they drink, or 6 drinks each time they drink. They might only be consuming 12 drinks within a week, but they're drinking 6 drinks within a day. Again, that can have an impact on their health and also their mental health. Definitely would contribute to some increased symptoms with depression. And so that would be something that you want to take that person forward to the actual screening process. And now the actual cutoff levels for drinking within a day for a woman or a male over 65 is 3 drinks in one sitting and 5 drinks within a day. All right, so the pre-screening questions can be grouped. This is an example where you'll see 4 questions that are focused on drugs and also on depression. So we commonly use a pre-screener like this in a situation where we're working with individuals at a primary there's a primary reason that we think that there would be a likelihood for substances being used. And for this project, we added the 2 conjoint screening questions that were developed by Brown and colleagues. They found that a positive response to either of the 2 questions demonstrated a sensitivity of 80% in a random sample of adult primary care patients when compared to the CDI-SAM, which is a reliable and validated diagnostic instrument based on DSM criteria. To put this in very simple terms, this 2-question screener where you ask in the last year, have you tried to cut down on the drugs or medication that you use? And in the last year, have you used prescription or other drugs more than you meant to? Lets you know that if they're answering yes to that, they're at risk. 93% accuracy that individuals who answer yes to those questions are at risk that they might have a mild to moderate substance use disorder. The negative predictive value of 93% means that the screen will only miss 7% of patients with substance abuse disorders, and that's the those 2 questions we talked about. Now, if the patient answers yes to any of the 2 drug questions, the assist is administered, and if yes to one of the depression questions, the PHQ-9 is administered. Again, the PHQ-9 is the Patient Health Questionnaire 9. The 9 stands for it's a 9-question instrument. And so I want to just pause for a second and explain why this is important. The average valid and reliable screening tool that you can implement is only going to be somewhere from about 8 to 10, usually a max of 10 questions. That maximizes its effectiveness because it can be done in a very short amount of time. But if you've seen what we're looking at on this side, it's highly predictive of whether or not that person would potentially need further help and need some intervention. So a reliable and valid tool that is able to identify early, but then even when you go to the screening, you go from 2 questions to only 9 questions. Again, the time frame, you're looking at 3 to 5 minutes. When you're doing the full-on screening, you're still only looking at about 15 minutes. So total time elapsed to do an effective pre-screen and a full screen is only about 20 minutes at the max. All right, so the pre-screen is very important. If scores are below the cutoff, screening can stop here unless patients who drink are frail or taking medication that interacts with alcohol. They may also have problems at lower drinking levels and thus may need advice to cut down. And again, as we talk about some medications, smoking and alcohol can have an impact. I remember when I was running a residential unit and it was something I didn't know. We had a nurse practitioner that was working with us, and she was having trouble stabilizing a few clients' blood pressure. And that's when I first learned about how much of an impact smoking can have on regulating blood pressure and the importance of cutting back on smoking for the person to have a more effective outcome in managing that high blood pressure. So that's just an example of real life, how these things can can really inform and help. And the goal we were talking about here is helping people to be in the best health possible. So let's talk again about the drink. So drinkers below the cutoff may benefit from reminders that no drinking level is risk-free, and any drinking can impair driving task. And so here are some of the objectives of using the assist. We'll kind of tell you about when to use it, considering the patient, how do you introduce the assist to the patient, how do you conduct the interview, and the scoring and interpretation. More of the how-to is not going to be covered in this particular training. That training is going to come later, and that's for the individuals who would like to learn how to actually implement this. This is just to expose you to it, to see it's possible, have you to get an understanding of it, and make a decision if that's something that you may want to do moving forward. For those who do decide that they want to see about implementation, you'll be free to reach out to us, and then we can have a discussion and see how we could potentially use the assist or other instruments within your nonprofit, within your clinic, within your church, whatever the case may be, local government entity, where you can be more effective in that screening process for these particular things. So the alcohol, smoking, and substance involvement screening test, which is called the assist, is you have it in your, for those when we do it, I'll give you a handout, you'll actually have a copy of it. It's a brief screening questionnaire to find out about people whose use of psychoactive substances, and it was developed by the World Health Organization and an international team of substance use researchers as a sample method of screening for hazardous, harmful, independent use of alcohol, tobacco, and other psychoactive substances. The key thing to notice here is looking at hazardous use, harmful use, and dependent use. We do screening for tobacco, alcohol, cannabis, cocaine, amphetamine type stimulants, which right now we're having some serious problems with methamphetamines. Not only have we had an increase in overdose deaths that are related to opioids, we've had an increase with deaths related to methamphetamine. Methamphetamine has been on the trend for the last 3 to 5 years, where people are using it IV. They're actually injecting methamphetamines. We had a recent case in Louisiana where an actual infant passed away because of breastfeeding for a mother who had been using a pretty high amount of methamphetamines and breastfed, and the actual baby did not make it. The baby suffered an overdose. Sedatives, common drug that is abused is Xanax or maybe Ativan. Hallucinogens, inhalants, and again, what we're dealing with in the epidemic is opioids, and it'll screen for a couple of other drugs as well. Pretty comprehensive tool, even though it's done in a very short period of time. So the assist is especially designed to use by healthcare workers or people that are on the front line within community organizations in a range of settings. So some of the settings you can do, as again, this is to reiterate, primary care clinics, emergency departments, doctors' offices, postnatal wards, courts, jails, and I've actually implemented this and done it within courts, jails, prisons, and other health and welfare facilities. And the target groups you're looking at, who are you reaching out to? So if you're looking at healthcare facilities, people who are impaired social or occupational functioning, you'll have a correlation with people start struggling with unemployment. So it might be a center that helps people to maybe gain employment. Screening in those type of settings good to where you have no wrong door, because they may be starting to struggle with some alcohol or substance use, or they're suffering with some depressive symptoms or symptoms of anxiety. And again, the personnel can be anyone from a midwife, general practitioner, a corrections officer, counselors. It can be a health and welfare worker, an administrator. And then it can also be done by clinical staff, nurses, doctors, and licensed counselors as well. So the benefits of screening for substance use, you want to look at, you screen for problematic substance use, and it provides an opportunity for education about the risk of substance use and can be used as a health promotion strategy to encourage communities, groups, and individuals to reduce the risk associated with their use or their substance use behaviors. Screening can improve the health of populations and of individuals. For those people whose substance use is not risky or harmful, screening can be used to reinforce that they are doing what they are doing is responsible and encourage them to continue their current low risk of substance use or alcohol use patterns. That's important because even when you're working in these places where it might be a specialized population, and I'll just use the homeless as an example, and they are resilient and they're doing well, they're overcoming these challenges, and they're not using substances. They're not screening positive for potential depressive disorder. They're not dealing with anxiety. You want to encourage them, give them the affirmation. That could be the thing that helps them to really get themselves in a good position. They may not have as many people at that point in their life that's really giving them encouragement. So not only does the screening identify where there might be issues, it also can be used as a way to just really congratulate people, affirm them, and let them know that they're doing a great job. So screening is most effective for those found to be at risk when it's combined with a brief intervention. So if they're at risk, we do teach the skills of how to do what's called a brief negotiated interview or a brief intervention. Again, this can be implemented by a community health worker who has been trained to do this with fidelity. We normally train with motivational interviewing and other tactics as well that will give you the skills that you need to communicate, as well as be able to help them to make some decisions about what they're going to do. And that brief intervention may be just helping them to understand the consequences of their use, and the benefits of that is that they may now make a decision to engage treatment for their depression, anxiety, or their substance use. At the population level, screening and brief intervention is a cost-effective method to reduce the burden of disease due to substance use. The World Health Organization estimates that, and they suggest that about 25% reduction in alcohol consumption worldwide would lead to a 33% reduction in disease burden due to alcohol, while the benefits of reducing tobacco consumption would be even greater. Screening for harmful or hazardous substance use can also help in the management of individual patients. Many common health problems seen in primary care may be related to substance use or may be made worse by the use of a substance. Screening provides information for the primary healthcare worker or person in the community that can help in the diagnosis and the treatment of the patient's health problems. Psychoactive substances can interact with medicines prescribed by the health worker and can cause health problems, and so information about the substance use is very important and for safe treatment. Again, if this is something that you think you would like to learn more about, and not just how it works, but actually how to implement, and maybe want to figure out a way how you could put this within your community organization, your practice, to where it can be efficient and effective, and develop the policy and procedure around it, we would love to help you out with that as well. And we do, like I said, some consulting, we do further training, and I'm glad that you were able to have some time with us today.